Welcome back. In case you didn't know, June is PTSD Awareness Month. And PTSD is a mental health condition that develops after a traumatic experience, and that's according to the U.S. Department of Veteran Affairs. Now, they say about 6% of people in the U.S. struggle with PTSD. And today, to talk about PTSD in Idaho, we are joined by Dr. Chip Roser with the St. Alphonsus Global Health Family Medicine Clinic in Boise. First of all, thank you so much for joining us here today.
Well, thank you for having me, Sherry. I really appreciate it.
Yeah, so what are some of the causes of PTSD? Because I think a lot of people hear about this, but maybe they don't realize that there are different types of cases and what causes it.
Yeah, it's very diverse, actually, and by definition, it's a trauma, but everyone perceives a trauma differently, right? And so you can think about things like motor vehicle accidents, and certainly the people that we see at our clinic, the people that have come through refugee resettlement, have experienced trauma through war, often sexual trauma as well, rape and other sexual assaults. And then people can also get it from weather-related events and natural disasters like hurricanes and tornadoes and those kinds of things can also be some of the causes where people start to develop PTSD.
Wow, so a lot of different factors that could play into this.
Absolutely.
In terms of, I imagine this might take a toll on folks. How does this influence maybe a person's life if they have PTSD?
Yeah, unfortunately, it can be a chronic illness that is very disruptive to both their personal life and their professional life. What happens is that when you experience this trauma, it sets up a fight or flight response where you get into overdrive and your stress system goes, just crazy and tries to get you out of this situation that puts you at extreme harm. And that's a very natural response. Everyone does that. But what happens with people that get PTSD is that they have an abnormal response to subsequent traumas. These subsequent traumas might be very small, like something that reminds them of the event. So perhaps if you went through trauma from, say, a military experience, if you hear a plane going overhead or see someone in a military uniform, that might be enough to trigger that full-on flight or fight response. And so even though it's not a huge trauma, the body perceives it as one. And so it's very disruptive in terms of your personal relationships. People often are depressed. They're anxious. They avoid those things that might be triggers. It's very disruptive in terms of sleep. People have difficulty sleeping. They have intrusive thoughts or nightmares. And so this is an all-encompassing problem that affects many areas of people's lives.
Right, and it kind of just brings it all back.
It does. It brings it all back.
Can you talk a little bit about maybe some of the resources out there for folks who might be struggling with PTSD?
Yeah, fortunately, PTSD is treatable, and there are a fair number of resources. Obviously, people that are eligible for military service, the VA has excellent resources. The primary treatment is really through mental health. Medications can be used, but they're usually used in conjunction with mental health professionals, primarily counselors. Cognitive therapy is the principal form of treatment, and so I would recommend people contact their mental health provider. If they don't have one, or if they don't know how to get in touch with them, they get in touch with their primary care provider who can generate a referral. But any licensed social worker or counselor can be a great resource. Even if they don't specialize in PTSD, they could probably know someone that could refer you to a place where you could get help.
All right, well, Dr. Roser with St. Alphonsus, thank you so much for joining us here on the News at 4 today. We'll be right back.